Hey guys, thanks for watching my video. My name is Katie and this is for course D028 and to talk about the different phases 1 through 3 in our ePortfolio assignment. So starting out with phase 1, we were supposed to read over the hospital readmissions program. So I learned a little bit more about what that entails and the different procedures and surgeries that is kind of underneath that program. So obviously hospitals want to be able to discharge patients and want to make sure that patients and family members and caregivers feel comfortable with the discharge plan, but also that there's the same understanding of aftercare being addressed and setting patients up for success. So it was kind of interesting to read a little bit more about that and the different surgeries and diagnoses that fall under that program. We also had a chance to look at patient scenarios. So the different patient scenarios that were listed were all different procedures or diagnoses that were within that readmissions program. So I picked the MI patient that was a 55-year-old male and had a lot of different social determinants of health that worked in his favor. So he had a steady job and income. He had a relatively safe neighborhood. Everything was in walking distance and well managed neighborhood. Had access to a grocery store within less than a mile away. Was starting some new medications, that kind of a thing after his hospitalization. And something that I noticed was that he did not have a follow-up with primary care. So that was one thing that I looked into for phase 2, where evidence-based practice came into play and ways that evidence-based practice would prevent hospital readmissions. So I looked into early follow-up with a provider within 30 days of a discharge from the hospitalizations and what that did for patients. So what I had found was that specifically for heart failure and MIs, that there's been some evidence of early follow-up being beneficial to patients. So it kind of closes that communication loop and care loop and kind of connects their entire continuum of care together much more seamlessly, and things don't get missed. So that's kind of what I noticed for that. Learned a little bit more about the public health interventions, the different individual, community, and system focused interventions. So came up with some stuff with that where it kind of tied in with the patient's community and being more involved and kind of encouraging health and heart health within his community. And for the third phase, learned a little bit more about case manager standards. So previously when I worked inpatient, I worked closely with a case manager. So reading over these standards really solidified my idea of what a case manager does and how they can be the best advocate for our patients. That's all I have. Thank you so much. Bye.